So diverse panel of speakers. So I'm going to start with introductions and then they're going to be pretty brief. I'm going to then ask as we move into the Q&A that each of the speakers, panelists elaborate a little bit about your company before answering the question. So Matt, we've already introduced. I'm going to start with those folks who I understand are in the room. Ron Rail is the owner and CEO of CNC Solutions, a robotics engineering company founded in 2000. Ron, can you raise your hand so I know? Okay, awesome, great. We've got Ben Waymeyer is the Jefferson County Administrator, and he's in the room as well. Awesome. We've got Mark Weirman. He's President and Chief Lending Officer of Exonia Bank, and he is in the room as well. Right? There you go, Mark. Mike Wallace is the President and CEO of Fort Healthcare. Mike, there you go. You've got your video on. That's great. Dave Whitty is General Manager of Manufacturing at Space Saver Corporation. And I think that's it, right? Am I missing anybody? Okay. All right, great. Let's jump into the questions. As we look at one of the questions we've been wrestling with and asking ourselves a lot at WDC is when you think about the trends that were already underway and how COVID has been a catalyst to advance those trends. One in particular really does stand out is technology and automation. And yes, there is this question around how it disrupts workforce, but it is also seen as a solution to offset some of the workforce challenges. So Mike, we're going to start with you with Fort Healthcare. And healthcare was one of the key industries that we highlighted in our Wisconsin Tomorrow report, and one that has definitely seen disruption. What investments are you seeing in the healthcare industry that are going to be changing the way that healthcare providers are doing business? And what do you believe has been most helpful in Fort Healthcare specifically in your service delivery in 2020?
All right, can you hear me okay, Gila?
Yes.
Okay, good. So thanks everyone for participation in the panel this morning, as well as the participants at the summit. So in the industry, Fort Healthcare is an independent, small community hospital. We're not aligned with anyone. We're independent. That has been a good strategy for us. Basically 85,000 people in our service area. It's very Jefferson County oriented. But we were not, as an industry, prepared for this pandemic. I will say that. I'm not indicting anyone. It's just there were a lot of things that we've learned as a part of this. The investments I think the industry has made, as well as Fort Healthcare, telemedicine, took us 20 years to change overnight. We've all been chipping away at video visits. Some of you maybe participated in some of those in the last 6 months. That's not going to go away. I think that's you look for the silver linings. That's a very positive development in the industry. It's kind of, why would you want to make somebody get up out of their house in the middle of winter, go into a doctor's office, sit in a waiting room with other sick people to go in and see a provider for 10 or 15 minutes, when in many cases, some of that care could be delivered from the ease and comfort of your home. So not all care can be delivered that way, but we're finding out that much care can be. And as a result of telemedicine visits, you're seeing the industry look at what else can we do? What other Bluetooth-enabled devices can we put into the industry? Bluetooth-enabled stethoscopes, glucometers, otoscopes, things like that, that we can safely begin to deliver care, not in the confines of an office or a hospital. The other thing, so I'm excited about that. This needed to happen for this industry. Certain parts of the country were a little more progressive. But we're participating in that. We've stood up our own video visits. It's gone very well. We're working through any nuances, but I think the pros outweigh the cons. The other thing the industry is working on is the supply chain assessments in that process. We realized the just-in-time inventory for expense management works very well when it in fact works. But as we came to understand, so much of the drugs and supplies in the United States come from India and China, sometimes upwards of 75–80%. And when the supply chain is broken like that, you begin to see some of the shortages and some of the scrambling. So we're reassessing that. There's a longer lead time, partnering with manufacturers to see if we can bring some of those much needed resources back stateside, so we're not so beholden to foreigners. Specific to Fort Healthcare, pivot a little bit into the telemedicine I talked about is in play here. We're seeing enhancements in terms of chronic care management. We think that with devices, we can better engage some of our patients towards not acute care, but just chronic high blood pressure, diabetes, some of those respiratory ailments that we think we can safely treat. We can more easily engage, provided they have the technology within their home. Some of the other things we've done, drive-through testing. If any of you have had a COVID test, you've had a drive-through. That's to keep you safe, to keep you out of the facility, to keep our staff safe. We're going to learn from that, and also as flu vaccine or vaccinations come up this month, towards the end of the month, how do we get more people vaccinated? So that's another positive development of an innovative way to get as many people the care that they need in the most safe environment. Our business health department is reaching out into the community, trying to be proactive. We want to keep the community safe. We want to keep businesses open and schools open as best as we can, but there's a right way to go about that. We're trying to partner again with the county and the state to distill some of a lot of the information. Some of it's misinformation, but we like to position ourselves as the trusted resource for all things healthcare within Jefferson County. So we're trying to do that as well. You know, it's interesting though, probably amidst all the training and the educated people and the certifications and licensure and technology that we have, I'm somewhat reduced to our strategy is 3 W's: wear a mask, wash your hands, and watch your distance. It's probably the single best thing that we can all do during the pandemic and for the foreseeable future till we get a vaccine. I know that's not very sexy, and we want to talk about all these other things, and we're doing those, but it's a little interesting here in 2020 that we're kind of reduced to those things. The last couple things I will say is a pandemic like this, and I think many can relate to this, it brings out the best in people, and that's what I'm seeing certainly at Fort Healthcare with our staff. Just as we have just-in-time inventory, we also have just the right amount of staffing. So it's been challenging, and we're doing well as we have to surge or mini surge for busy days and shifts, but we're getting through that. Probably the single greatest investment we have made is in our employees and our human resources. And we made the decision back in March that we're going to create some what we call income security. We weren't going to lay anybody off. We weren't going to curtail hours. We're going to redeploy people. And while we began to shut down in March and April for elective services, we didn't send anybody home. We redeployed them. They were taking temperatures at the doors. Some of them were giving shots, the drive-through shots, because we wanted to preserve the culture, because we felt that was so important as we come out of the pandemic. We do believe we're going to have a future, but we wanted to keep our employees with us. I think that's paying off significantly for us right now, because as the state of Wisconsin is seeing an increase in the rise of cases, we're being tested both at Fort Healthcare and throughout the state, but our staff are there with us. This is what they do. They're professionals. I couldn't be prouder of what they're doing, but I think we're going to end up saying that's some of the best money we've ever spent, is investing in our employees in addition to the technology we've invested in.
Thank you so much, Mike. I really appreciate that. And on that note, with the 3 Ws, it is to address and comply with those 3 Ws is really the way we're going to try to get back to full economic recovery. We wholeheartedly believe that as well. Mark, so with bank and service and retail to some extent presence, what types of technologies and automation investment are you seeing in the banking industry, and specifically for yourself? And also, while you're addressing that as it relates to the bank itself, what have you seen as far as your customers are concerned on the commercial side in any types of investments that they're looking to come to you to help them make when it comes to technology and automation?
Yep. So, it's only a bank. I would say we're probably a microcosm of what's going on in the general banking industry. So I'll talk a little bit about what we're doing, and then I'll address the question of our customers. So, as difficult as the pandemic was for all of us, it gave us a unique opportunity to, I think, hear from our customers about what they like about interacting with us, and how they have interacted with us historically, how they'd like to interact with us in the future. So, like most banks, we shut down our lobbies for about 2.5 months during the general shutdown. And predictably, our drive-through traffic went way up, and online traffic went way up. So we were really curious to see what would happen when we reopened the lobbies again, as to if those behaviors would continue or if people would come back to the bank in person. So a little bit of a mixed bag. Going back to some of what Matt said about demographic trends, we saw, for instance, our branches in Watertown, foot traffic in the lobbies returned to pretty much a normal state within a month or so, and partly because we tend to have an older demographic who are our customer base in Watertown, and they prefer to come in person. On the other hand, our branches in Oconomowoc have not returned to normal foot traffic yet, so we probably have a younger demographic in places like Oconomowoc. So it's been an interesting mix, but we also recently did a customer survey, and we asked our customers how they want to interact with us, and all of them, for the most part, said they want a mixture. They don't want the branches to go away, but they also want us to invest more in technology so we can get better in those areas, so they have more options. Basically, what they're telling us is they want options. So we've done that. We already had things like online banking, obviously, and the mobile app, and person-to-person payments, and remote deposit capture, and those sorts of things for our customers. But we're stepping up our efforts to invest more in those technologies. Just this week, as a matter of fact, we're rolling out something called Zelle, which many of you probably heard of, which is kind of a nice person-to-person payment system that a lot of banks have started using. So we're going with that this week. We're also looking at business online mobile apps. So most of you are familiar with the consumer-driven mobile app that you probably have on your phone for your bank. And we're looking at a mobile app for our business customers as well, so they can do the same kind of things that our consumers do. As I said, branches aren't going away. We're going to continue to invest in our branches, but we're going to invest more in the online part of our business. The other thing we're looking at internally versus how we deal with our internal processes is more efficiency. So we have, believe it or not, in the banking industry, a lot of repetitive type processes that we do, a lot of redundancies. So like a lot of businesses, we have to find ways to automate and do those things better, more efficiently, quicker, with the same number of people or fewer people down the road. We talk about demographic trends and population issues, and we're not immune to those things as well. So from a customer perspective, you asked Gail about how our commercial portfolio is doing. I'd say for the most part, they're doing fine. We have some customers that are doing much better than they were a year ago. We have probably the vast majority on the bell curve that are doing about the same, and we have some who are hurting a little bit. So it's kind of a mixed bag of what you'd expect.
Great, thank you so much, Mark. I'm going to turn it over to Dave. So with how manufacturing has been affected in some respects. As we were seeing reports, it's coming back, because it is one of the industries that was deemed essential in most situations. And again, it's one where it would be really interesting to hear, what did you see as already trends, and what you were moving toward, and how has COVID and what we're going through with recovery accelerated investments in automation, new technologies to increase your productivity and efficiencies. So it would be really helpful to hear a little bit more about that.
Yeah, good morning. Thanks for the invite. I'd like to talk a little bit about, so the labor thing's not been new for us at Space Saver. We've been struggling with labor availability for years. We had up to 40% turnover in the plant in 2018 into early 2019, and we've done some work to make that better. One of the key investments we made early on was, how are we going to communicate with our labor pool? How are we going to communicate with the company when it comes to shutdowns, specifically to the daily, we have to check in every day and kind of fill out a form saying, hey, you're healthy and we're good to go to come to work. So we invested in an application that we can communicate with all of our folks with, which has been just a savior for us. It's called Ready App. It's what we use to communicate everything. So having a solid foundation where everybody has the same communication method was key for our kind of navigation through this COVID process. That's been real big. Our other focus as far as capital equipment spending has been, how do we reduce our dependency on skilled direct labor, because it's just not available, and how do we either maintain or hopefully increase our capacity while doing that? So a few areas of focus were in forming. So we form metal at Space Saver. We make high density mobile solutions out of metal. And the days of people graduating high school and wanting to become a great metal fabricator are they're dwindling. So how do we take that skill set out of it? And as we lose folks and they take all that tribal knowledge and all that skill out of the workforce, how do we bring these new people back into the business? And how do we reduce that ramp time? Instead of taking 6 months to develop a person, how do we get that to 2 weeks or 3 weeks? And that was through automation and taking the setup of the machine, taking that offline and making it automated. So you could have someone programming the machines offline, then an operator comes up and they pull up the program, the tools come into the machine automatically and they make parts. It's helped tremendously. We've taken that 6 month ramp up time down to maybe about 3 weeks, that an operator can walk in front of a machine and become productive, which has been just a tremendous asset for us. Again, that offline programming piece of it, something that's been around for a while, but it's new to us. Having that technical resource in the back room doing all that work ahead of time, so the operator just has to walk up and make parts instead of trying to figure out what tools I'm going to use, what's the bend sequence going to be, reduce scrap, increase throughput. It's just been phenomenal. Another area we've been looking at doing a little bit of work with is robotic welding. Skilled trades is difficult to hire into Fort Atkinson specifically, at least for us. So taking some of that skill out of the work and making it robotic has helped us as well. So that's a really good investment path for us, is down that path. We still have an awful lot of equipment that needs automation, but automation is very expensive, and it's difficult to get that ROI. Our company is very tight return on investment periods that make that kind of thing difficult, but we're working through that. We have a plan to submit some automation projects in the coming year to kind of catch up with the industry. So we have machines that can run without a person in front of them, that kind of thing. We're kind of behind in that aspect, but again, the investments are very large. Our financial constraints, or not constraints, but our financial processes are very tight as far as return on investment. So that's a barrier for us, is trying to get through that. As Mike kind of mentioned, investing in our people is huge. When we saw that 40% turnover, we made the decision that we were going to invest in our frontline leadership and leads and develop them as leaders to hopefully improve that retention. That process started this last year and it's going to go through next year. So we're investing and just developing those leaders to hopefully improve our retention. It's helped tremendously so far, but we got a great group of people. We just don't have enough of them.
Yeah. Well, to that extent, you started your retention initiative kind of right as you were heading into COVID. And so how have you managed to, sustain that? And coupled with that question is the point you made on ROI, right? So there's ROI in customer retention, efficiency. Can you speak a little bit to how you also look at ROI as it relates to your employee retention and the investment you're making in leadership?
Yes, it's huge. It's not a cheap date at all to train our leaders. We've got about 60 people going through leadership training. It's about an 18-month process, and it's not inexpensive. It's a major time investment as far as getting the training done. We believe that it takes probably 12 months to 18 months for a person to onboard, and they really know what's going on, and they're productive every day, and you don't have to have someone helping them out. So you look at $40,000 to $60,000, $70,000 every time you turn someone over. You're kind of falling backwards, and maybe even more than that. So it made it pretty clear that we needed to invest and help these folks, stay. We have good pay, we have good benefits. People I think leave due to bad leaders more than they do to the job conditions. So it was very clear that we needed to invest in that.
Great, thank you so much. We're going to go over to Ron, and we're talking about investments in technologies and automation. What has been your experience with the different type of technology or customers, or that maybe your customers are asking from you to respond to their needs? If you can touch on that, and any type of, back to this question about ROI, what's the most effective way to demonstrate an ROI when it comes to the kinds of investments that are necessary in technology and automation?
The pandemic hit. We typically work with manufacturing engineers and project managers. Once the pandemic hit, we started getting phone calls from the C-suite, people saying, "Hey, what is this automation? What are robots?" It really kind of shocked us because 20 years now we've been with robots and automation in place. Just how many people don't understand automation and robotics. I think the biggest challenges that we're seeing is, like Mark mentioned, space saver. Number one is talent. You put a robot in, somebody at that facility has to know how to run it, manage it, maintain it. The other problem we see is capital. Mark mentioned cost and the ROI of automation. Typical project, you throw a robot in front of a machine, might start at $250,000. So there's no standards in ROI. I deal with customers in food and bev, manufacturing, fabrication. Everybody has their own little secret sauce to ROI, which can be a problem. We're trying to replace an OpEx problem, which is human talent, workforce, an operating expense, capital expense. So they go into the ROI, they want to see a 12-month, 24-month ROI on capital. So what do? They go to the bank, they say we need $250,000, we need $500,000, we need $1 million for this investment. Right now, banks are nervous with the economy. I think they're nervous about supporting capital projects of that magnitude. So here we sit in this kind of conundrum. We need automation, manufacturers need automation, we need talent. So how do we solve that? Talent, number one, until we correct our educational issues, with developing that talent, we're always going to be in this mess. I look at Jefferson County, I work with probably 6, 7 different schools in the area on tech ed. I think we only have one robot in Jefferson County at school, sitting right now collecting dust because there's not enough interest in students to actually take a class in robotics. So how do we put automation into factories? We don't have the talent on the factory floor to actually run and maintain the system. So until we correct that problem with the education system, we're going to continue to have this problem here. As far as capitalizing these projects, like I said, if you look at a person working in front of a machine, they're an operating expense, there's overhead, there's indirect costs, there's liability, there's risk, injury, dependent motion. Still, manufacturers look at that as an operating expense, very risky. Now we look at with the robot or automation in place, fixed cost, but it's capitalized. You come in with a quote for an automated system. It's not going to eliminate 3 people, but it's going to take the job, do 3 jobs, essentially. You look at $500,000, you get a sticker shock, you go to the bank is like, well, we don't know. It's tough to capitalize. So until we get past those 2 things, I think we're going to continue to have a problem with automation. We are seeing an uptick. Companies that get John Deere, on automation, Dodge County, Space Saver is getting it. Some companies like Mac and Dodge County as well. So the companies that had automation going into the pandemic are definitely in a better position. Companies that are now calling us in reactive mode saying, hey, we need robots. Come on in. But I think it's going to continue to struggle. As an automation company, we're doing well. Robot sales are up. But you know, that average project will take 16, 20, sometimes 24 weeks to design, implement, install, train, and board. So a lot of challenges we're facing right now. Number one, just in educating our customers what automation is.
Ron, I had a quick question, just as a follow-up. Was there some, I guess, insight as to why there was an increase in the requests to you during this time with COVID for more automation? If I heard you correctly, I was having a little bit of a hard time hearing you. What do you see as the reason behind an increased desire for that, even though, as you said, it's been around for a good few decades?
Sure, you know, there's always been a problem last number of years in workforce talent. I think once the pandemic hit, a lot of the workforce were working from home. We already had these manufacturers are busy. They've got contracts. At this point, they have a hard time filling them. Now, also, we have a pandemic and everybody's working from home. Problems compounded. So we had groups of C-suite people calling us. I don't know how many Zooms we did the first few months of the pandemic. We're sitting around just educating our customers what they can do with robots, what they can do with automation, and the misunderstandings. You know, automation is not strictly robots and hard tooling equipment. Automations are also a process. We can take data from machines and send it out to ERP systems, back to management remotely. So there's a lot of that we're looking at now as well that our customers have questions. We do have people working at home. Machines are operating on site. How can we get that data dynamically back to working at home? So we're seeing an onslaught of software automation. Well, it's really been a huge crash course in automation for us. We find ourselves being more of an educator as employees.
Great, thank you so much for that. I'm gonna move on to Ben, and you know, being with an economic development agency myself, you know, we're not always seen as being on the cutting edge of, I guess, anything. But we had to get pretty agile to respond to what industry was needing and what our communities were needing during this time. But could you speak to just what the county's been experiencing? How have you been responding in making choices on what to invest in? And you know, with the budgets as they are, how have you gone about that prioritization process? And again, in such a concentrated window, that's what I think has just been so challenging here is it's not that we've had a few years to think this through. So it would be great if you could speak a little bit to that, Ben.
Sure. So as I look at our technology from a government standpoint and delivery, I basically break it down to 3 buckets. So the first is our internal business operations. Our second is our communities. And our third is really the external engagement process. So I'll start with the last one first. As you've experienced, we're trying to figure out how to do larger meetings in unique buildings. For Jefferson County, the building we're sitting in right now is about 40 years old. Our courthouse is 55 and 60-year-old. How do you try to create an environment for remote meetings, for full participation, when you had technology from almost 60 years ago? And how do you adapt to that? And how do you create the experience so it's more in line? So when we started, we were able to get a lot of our meetings done remotely, and everyone was just excited we could do it remotely somehow. But as this has gone forward, it's more of what is that experience? How do we engage better? And there's been some positive things in terms of more transparency, in terms of opportunities for people to see meetings online and then engagement process. But part of it is how do we shift our skill sets to attain that? Do we need a multimedia specialist in some ways as we look at the future? That leads me to the next part of external engagement, is social media. Julie talked a little bit about her engagement process and economic development, but we always don't think about that from a government perspective of how do we get the message out. In some cases, as we've gone through the process of some of the political atmosphere, the social media is how folks are getting the news. It's in some cases, it's not just the news media anymore. How do you help get the message out? How do you engage in a process so we can be positive of what's going on in a proactive matter? And the other part is just we had to talk through how do we do new meetings in a different way. We just can't simply say we're going to do a county board meeting remotely. We had to ensure we had this thing called legal requirements met. We had to go through a process to make sure we're statutory compliance to ensure that decisions made and voted on were proper. And it followed open meeting laws and people had access to decisions being made. And so that's kind of part of our external engagement process that we work through quickly. And it's an area, quite honestly, I think we're going to continue to see going forward in a positive way. I think we're going to continue to see more remote meetings. We're looking at some investments in our county boardroom right now. So it's not just a camera and a laptop, but it's more of a camera-centric approach so people have a better experience when they're reviewing it remotely. The second is community. You heard broadband mentioned a few times. You talked about telehealth. You talked about working at home and telecommuting. We're at deficit in Jefferson County, same with Dodge County. And we partnered with a PSC grant going into last year, and unfortunately, we scored pretty high. But the thing is, what we continue to do with Dodge County is we continue to engage with the private sector partners. We continue to path forward to look at opportunities for investment. And continue to talk with the PSC, quite honestly, and we hope to be in a better position here shortly that we can enhance broadband going forward. But one of the biggest things that we knew coming into this, and we have to accelerate the access to broadband. We talk about this continuously in various comprehensive plan meetings, strategic plan meetings, but if you look at the future, our workforce, of our education, of telemedicine, everything, quality of life, quite honestly. Our Bridges library system has unbelievable access to educational materials or just videos. How do we make sure the person who doesn't have access can get it? Working with the schools in terms of wireless pucks. One of the largest checkouts from our libraries is the wireless access point. There's waiting lists. So how do we engage in that process to do it? So that's probably one of the biggest things we've been trying to focus on is broadband. Then the last part is just our internal operations. Mike mentioned telehealth. Quickly overnight, we had to find a way to get our human services to be telehealth. Not only because of the fact that a lot of our revenue source is just like medical, right? We have to bill for the services we provide, whether it's to a private insurance company, or Medicaid, or Medicare, et cetera. But quite honestly, when this happened, our crisis calls just continued to increase. They were high before COVID, and they just accelerated. So how do you provide the care for those who need it the most? And telehealth proved very beneficial. Luckily, we had many things in place already. We had a full electronic health record system in place that we augmented with signatures to help make sure we had the proper things in place and augment with our programmers. Overnight, we had a call center for our benefits program that we administer, and also we had to do that remotely. So our IT team had also set up a call center remotely. They did an unbelievable job quickly doing that. But what technologies do we need in the future to make it even easier? But it also accelerates simple things we were trying to fix before COVID. Customer service engagement, so simply how can you do an online reservation for the parks? You can do an online payment. We were looking towards that because we were trying to get away some of our mundane tasks to reallocate some of that staff time, and this just accelerates some of the resistance that we had to get that done. And then I think the last thing is all of this in terms of technology, cybersecurity, cybersecurity, cybersecurity. And what are those investments as we look at the future? What training, not just the hardware that we need to protect the systems, but training for our staff and public. I think most of our business leaders know for sure that the easiest access point is a simple email that gets through all your filters. Someone actually clicks on it. Something appears on your machines. So how do we make sure we're conscious of that, especially some of the materials we deal with from a HIPAA standpoint to DOJ information and court systems? I could go on and on, but I think the one thing is we've learned a lot. We're looking at some policy changes internally of how can we provide services better. I just think of our veterans group. We had veterans having to come to our office for simple services. And all of a sudden, we're finding ways to get them remote access so they can talk to our counselor. Guess what? That's going to stay, right? Because that's the right way we can do it to provide better service. So that's what I have.
Thank you for that. I really appreciate it. And as we head into wrapping up and turning it over to any questions we may be getting from the participants, Matt, I wanted to maybe turn it to you to kind of, wrap up as you've heard from the different perspectives of service providers, our government providers, economic development, as well as industry. As you and I have talked quite a bit, especially as we were preparing the Wisconsin Tomorrow report, and we were thinking about, what those trends were heading in, and those that have accelerated due to COVID. We talked about the fact that it's not about necessarily going back. It's about how to, going back. It's just getting on the right track, not back on track, right? And you highlighted daycare, and you highlighted, quite a few things that we included in that report. Can you maybe sum up and say what, as we see, where does technology fit, and how do we communicate that story of where investments are critical in order to really kind of shrink that recovery time frame for us to get back to where we, or get on the right track to where we need to be heading. That was a long-winded question. But maybe just observations, in the discussion.
And as I think a lot of the panelists said this morning, so many of these trends were already in place. It's just that the pandemic accelerated them, and a lot of us just weren't fully prepared for how fast we had to depend upon a lot of technologies. So we've known for years that communities have inadequate broadband. We've been working on ways to bring it to communities in both a timely but also in an affordable fashion. But now more than ever, everyone on the panel today highlighted the fact that we need access to broadband. Childcare we always knew was an issue. Childcare has always been incredibly expensive. It's been hard to get. But again, I think with the onset of the pandemic, we really put a bigger emphasis on it, and it will be an emphasis going forward because as we need more people in the labor force, childcare is one of the biggest barriers that a lot of families face around the state of Wisconsin. And then I really liked the comment on automation is not just a machine, it's a process. And I think getting people to understand that automation is not just about robots and machinery in a facility replacing people's jobs. It's about how do people adapt to those new jobs and new skills and new technologies that they need to be part of the labor force and to help companies become more productive. I think there's a lot of education that has to happen around automation, Industry 4.0 and IoT for the general public. It's not something to be feared necessarily. It's something that we need to understand and we need to embrace in a lot of instances.
Great, thank you. And yeah, to that point, hearing from Ben, it seems really obvious when he was highlighting the different skills that are now needed by the county itself. You often think about skills and workforce as it relates to industry, but it's really pretty broad broad-based on where we're going to need to be looking for cybersecurity experts and multimedia experts and broadband. It's an all hands on deck. It was one of the top 3 priorities we identified in our recovery report because it's oftentimes seen as really just a rural issue. And when you're seeing the impact to how we live, learn, and work, and how we even take care of ourselves from a healthcare standpoint, it's accessibility across the board in rural and in urban and wherever the digital divide may be. So thank you for that wrap up, and thank you to all of the panelists. Really appreciated this, and especially considering the virtual format. This has been really went as smoothly as we could expect it to go. So I am gonna ask maybe Julie, I think, to let us know if we've received any questions through chat that we wanted to put out there to the panelists.
Julie's indicated that we have not gotten any questions via the chat, so I'm going to throw some questions back out to our panelists. Obviously, we heard a lot of data today. Matt Kira's really teed us up. For those of you who have been in this room for our annual meetings over the years, you may recall that a couple of years ago, our whole focus was demography is destiny. And Matt did a really nice job of highlighting how those numbers are changing and not getting better for us. And all of our panelists talked about the need to capture data and use that in a different way in their industry sector. So I guess what I'd like to do is kind of throw that back out to our panelists and ask them, since the pandemic, and I think Mike Wallace, you made the point that, you know, it took us what, 20 years to change overnight. Since the pandemic has hit, how are you using data differently in terms of thinking about how you're delivering services? Not that you didn't have the data available to you before, but I'm curious as to, are you capturing different data that's helping you drive decisions right now that you weren't even doing a year ago? So let me ask, I will start with Dave. You're out there virtual, and Mike, so I'll start with you first, Dave. What's the kind of data are you capturing these days at SpaceSaver that you weren't capturing before, and how are you using that to make investment decisions?
I got to say, we were probably always capturing the data. I just don't think we were using it. You know, I think we had, you know, the things in place, but they're kind of those blind metrics that didn't really get the attention they needed. And we're really using the data to drive in the shop. You know, we're looking at the schedules differently. We're looking at the people's availability. We're looking at the skills matrix to understand, you know, who are we going to put where, when, how are we going to forecast the labor to the upcoming production, especially with the squeeze on labor. You know, we used to flex our staff up with temp labor and our contract labor. And with the pandemic, we don't go to that pool anymore. We don't want to introduce all those new people into the building with that constant rotating door. So it's really trying to drive the right people to the right place at the right time and just daily looking at where they're needed, how we're going to use them. That's just kind of one of the key things we're doing.
That drives another question. So are you finding that you're maybe looking to capture your data in a different way right now, right? It's like, well, we always knew that we had X, but now that we're really looking at the data, maybe we need to have a different software program. Maybe we need to be capturing this in a different way. Are you seeing that?
Absolutely. We've kind of been trying, we hired a key role last year in supply chain management, and that person really manages our plant capacity and through the team. And we've really taken a different approach about how we're managing the plant and the data that we need and where it's coming from, and requiring information from our customers, you know, for forecasting information, which we've never had in the past, surprisingly.
Yeah.
So it has driven some changes in our business and how we're looking at data, where we're getting it from. Definitely.
Yeah. And I'm wondering as well, Ron, with the robotics, are you seeing more of a request from your customers for different types of software so that they can capture the data on the use of the robots in different ways?
Yeah, I think you hit on the head with the how. I recently spent 3 hours in a augmented reality lab, Halo 2, blew my mind. Typically, if the system goes down, we send a service tech out to the field to a customer on site. Both the pandemic, we're exposing ourselves. Augmented reality, you've seen that on Iron Man, you've seen that on movie sci-fi. It's real. It's real. We can essentially send a lens, augmented reality headset to our customer and put it on. We can see what they're seeing. We can collect data from our systems as well. And we can help assist either startups or changeovers, setups, and collect that data in real time. So the challenges we're seeing, traditional is what Ben brought up, cybersecurity. All of our robots, we try to have to plug in a Ethernet cable. So I can remote in from anywhere to anywhere in the world and fix that robot. Challenge right now, I don't want to call it ignorance. It's the fear of the IT department. Like, oh, we're plugging into my firewall. No. So we're looking at the how and alternative methods of actually collecting data. And I think what the world really doesn't know, I see it every day. We see the latest technology, it's fun, incredible, it's out there. But to get the rest of the world to accept it, say, hey, this is real, augmented reality, you can be able to send a headset out. I'll give a headset to anybody flying a robot just to be able to interact dynamically on the spot, collect that data, help that start running or started or right back.
Yeah, it's not just a fad.
No. It's not sci-fi. It's happening. Those that are adapting to those technologies right now are the ones that are going to be advancing.
Yeah. So, Mike, augmented reality in the healthcare provider industry. Robotic surgery's been around for quite some time, but what kinds of things are you seeing there specifically?
Yeah, in terms of robotic surgery, that's more of a big city. We have no business doing that. My position or belief is that's really not a community hospital application yet. I think you have a lot of community hospitals doing it, but I think a philosophy is if you're not drilling on some of these procedures every day, morning and afternoon, you probably shouldn't be doing them. But aside from that, we're not saying no to that. We'll continue to examine it. I think in the industry, a broad brush, I would say, is we're data rich, information poor. So we've gotten much better at what do we need to know. Before I go back to the supply chain, it was just it just happened. And now we're realizing, oh my God, the supply chain has been broken. How many gloves do we have? How many masks do we have? How many tests do we have? And it's kind of been a somewhat manual mode that we've kind of just been getting the word out daily of here's where we are. Let's manage we're going to burn through this in 5 to 7 days if we don't take appropriate precautions. I think we're getting better about being able to automate that. The other thing, we have done a pretty good job of collecting data, turning some of it into information. I think chronic condition management has exposed or shown us where the gaps are in care treatment. Some of that has been very helpful right now as we had to kind of shut down. We can now go back and see all the diabetics in our community and where they have gaps in terms of eye exams, foot exams, hemoglobin A1C. What are we doing? How do we get them the care that we know is necessary to treat that disease process so that they don't just get lost in the system? So I think that's all been pretty, that was there pre-pandemic. I think this has just really enforced how cool it is to get data that you can turn into information that's very actionable. You can operationalize it and you can get people the care that they need and using telemedicine, for example, again, that would be able to manage their chronic condition.
And that's powerful, Mike. Thank you. In the banking industry, obviously, you've always been about collecting information on your customers. But what has that changed? Has the pandemic changed the type of information? And how are you, as Mike just pointed out, operationalizing that, delivering different programs or services because you've now got data that's driving it?
Yeah, I mean, it's a great question. And thank you. We obviously are privy to a lot of very powerful data on our customers. And, you know, what's happened in the last few months has really accelerated the need for us to do a better job of analyzing that data. We can understand how better to interact with our customers and where to invest our resources going forward. You know, in our case, we're planning to invest more in online and mobile resources because that's what our customers are telling us they want from us. So the other thing we are very cognizant of in the industry is that we have a lot of data that's obviously very personal and very confidential. So cybersecurity is at the top of everyone's minds in the banking world, and you know, we work every day to make sure that we're protecting that data.
Right. And certainly, thank you, Mark, and certainly in government. This is a huge issue, as Ben pointed out earlier. Some of the shifts that we've made have been just amazing. And as someone who's also inside of that, I've been privy to it. I haven't liked it all. Gotta say, I haven't liked it all. But Ben, as we wrap this up quickly, what kinds of data? I mean, I know we've instituted at the county government level a lot of new systems that are giving us information in a very different way than we've had it in the past. How are we using that?
So a lot of ways when you look at historically, that allows us response to getting the information out, or the first people getting the money in many cases, right? So in a lot of cases, our reports were driven of, hey, what does the state and feds want? Or if we got a grant, what do they want? But what did that data always tell us to do? So for Vicky's point, part of what we try to do is tie our data and metrics back to our strategic plan, our comprehensive plan. So we went through an exercise called priority-based budgeting about a year and a half, 2 years ago, where the department is really trying to focus on those cost allocations and how does that drive some of the data metrics back to the budget too. And a lot of that, kind of Mike's point, we have a lot of data, how to use that information. So part of it also becomes, is it business operation, or are we trying to solve community problems with that data? So from a business side, an example of our telehealth, we're having more on time, more people attending their sessions with our human services department than before because of telehealth. Great thing, because A, we're getting people help they need, but B, the revenue is coming in because we're having people use service. Win-win for everybody, right? But the other part is just really is we have this thing called GIS. It has a lot of data fields by layers of everything within the county. And how do you take that data with movement? So the recent example how we GIS and other data is we have the second most licensed long-term care facilities in the state behind Milwaukee County. And what happens in many cases is you have a lot of calls from first responders, as an example, back to those facilities. And so with human services and a couple of our first responders, we kind of mapped that out, and this impacts like for healthcare too, is how can we be more proactive in terms of how those people or the facilities are dealt with, so it's not always an emergency 911 call, right? And save those services, there's other things that are. So our goal is then how do we take the data, tie it back to GIS? What is the skill set we need, by the way, to help with that process? And then tie back to policy making decisions so we have that proactive investment in some cases versus that safety net reactive.
Imagine that, using data to actually engage in preventative measures and activities so that we don't have to pay for expensive intervention. It's a beautiful thing. I want to thank all of you who were part of today's meeting. I certainly want to thank our panelists here and via Zoom. So a round of applause for them. Everybody did a great job. Thank you. I also want to thank all of the investors, the people that financially support our economic development activities. Big thank you to my board of directors and a huge thank you to my staff. And making sure that you know who they are: Roxanne Whitty, Deb Reinbold, and Julie Over are the women who make this all happen. I just stand around. So I really appreciate everybody being here and supporting our efforts, and we will continue to work on your behalf in order to grow our economic base across these two counties. Thank you, and have a wonderful day.
Thank you.